HPV is nothing but human papilloma viruses. They are just small DNA viruses which infect humans. More than 100 types of HPV viruses have been detected, but in that only around 15 to 20 types are high risk type with oncogenic potential. What is oncogenic potential is cancer causing potential. So these viruses have the ability, these high risk types, about 15 to 20 varieties, have the potential to cause cancers. And the cancers that they can cause in the human being, whether it's a male or a female, includes oropharyngeal cancers, any anogenital cancers, and in women specifically cervical cancers, vaginal cancers and vulval cancers. About 15 varieties of HPV viruses have been identified which can cause anal and genital cancers. And in those varieties, HPV 16 and 18 is implicated in about 70% of cervical cancer cases. So by targeting these viruses, if we can vaccinate people against these viruses, we hope that we will prevent future precancerous condition and cervical cancer from developing. And there are about 2 types of cervical cancer which is available in India, that is Cervarix and Gardasil. Both of them cover HPV 16 and 18, and Gardasil also covers other non-oncogenic or non-cancer causing virus also, that is HPV 6 and 11, which prevents anal warts. So by covering or producing immunity against HPV 16 and 18, we hope that in future cervical cancer is prevented from occurring. There's one more new cervical vaccine called Gardasil 9 is available in other countries, not yet in India. This vaccine is a little better vaccine, I think, because it covers almost 7 different types of high risk HPV types. So you get immunity for at least 7 high risk varieties of HPV. So the antibody protection level will be little much better, but still, because HPV 16 and 18 cause 70% of the cancers, cervical cancer, our normal Cervarix or Gardasil, which is available in India, also is quite effective. And also sometimes we have cross protecting antibodies which also not only protect against 16 and 18, it will also protect against other virus types also. In general, most of the cancers you do not find a causative factor, but cervical cancer is an exception in this, because in 90% of the cases the causative factor is said to be human papilloma virus, and because it is a virus, so some prevention can be done through vaccination. Second thing is, this virus doesn't cause cancer directly. Most of the time these infections are warded off by the body, but if persistent infection is there, they cause some changes called precancerous conditions, which if detected and treated early, you can prevent cervical cancer in the long run. So to say that cervical cancer is a preventable disease is not incorrect. The primary tool in prevention right now is regular screening. How do we do regular screening? Is by undergoing regular pap smears from your doctor. When to do it? You should start it as early as possible, whereas in UK and US they start it as early as 21 to 25 years of age. But in India we usually start once you're sexually active, and once you start doing it, you have to repeat it every 3 to 5 years till you're 65 years of age. Currently, along with pap smear, we also do HPV DNA testing to detect whether HPV is already infected the cervix or not. If pap smear and HPV DNA test is combinedly done, then you need to screen yourself only once in 5 years. The second mode of prevention is vaccination. WHO recommends vaccination for girls as early as 9 years of age, 9 to 12 years ideally, but if you take it afterwards, they say at least 3-dose vaccine needs to be taken. The efficacy of the vaccine is better if taken when you're sexually naive. Once you're sexually active, the efficacy of the vaccine comes down. but the vaccine is approved till 45 years of age, so any sexually active women can take it, though the efficacy is reduced.